Welcome to Deeper. This is an episode on all things sex brought to you by Adam and Eve. I'm Dr. Jenni Schuyler. I'm the resident sexologist for Adam and Eve. I'm a certified sex therapist and licensed marriage and family therapist, and I run the Intimacy Institute in conjunction with helping Adam and Eve with all things related to sexual education and sexual health. So today's episode is on cancer. How does cancer impact our sexuality and our sex life? And great solutions on how to move forward in the midst of this, whether you are the survivor going through cancer or whether you are the partner who is experiencing the impact of this. Okay, so let's get started with some facts on cancer and how it impacts us. So I'm going to cover, just so you know, I'm going to cover mostly prostate cancer and breast cancer. One, because this is October and it is Breast Cancer Awareness Month, and we are giving a big shout out to all of the women and men who have undergone breast cancer. Whether you are a survivor or you have passed, our hearts go to you, and we really want to talk about ways to optimize our living if we are blessed to be able to do so. Okay, I'm going to turn on a little light so I can read my notes here too as we get going. So one of the things that happens is that cancer patients will go into their primary care doctors, and the biggest question and the biggest worry they have is their sexual functioning. 70% of patients really worry about this, especially with prostate cancer, and the primary care physician may or may not have the answers. Or more commonly, the primary care physician may not bring it up, right? What primary care physicians are trained to do is take care of your medical issues. They're not necessarily trained to talk about your sex life or your sexuality. So it is so important to be able to be your own advocate. So if you take nothing else away from this episode, I really want to encourage you to be your own advocate. Ask about your genitals. Ask about your sex life. Ask about how your hormones may or may not be working in your body and what that's going to mean. So for instance, you're a female going through chemo and radiation, your levels, well, actually all our hormones, it doesn't matter. Our human body is going to go through a hormone deficiency, because men may be going through androgen deprivation therapy. That's really common, ADT, when they're undergoing prostate cancer. Women are going to have an absolute drop off around their estrogen and go into, if you're not already in menopause, into early menopause or surgical menopause. And so our hormones are not working for us, and that's okay. We're going to talk about how to work with our bodies anyway, but that may mean you need a lot of lube. Lube is your best friend. Whether you are 18 or 81, lube is your best friend, especially if you've gone through a cancer journey. And if you have a partner who's gone through a cancer journey and they're a little shy on lube, make lube your best friend, because lube will help in the midst of hormones not working as well for you. Now, that's not always the case when it comes to our erections, so let's talk about erections. So if you have prostate cancer, one of the things to make sure you do ask your doctor are, what are the different options for me in terms of, do I really need to take out the whole prostate, right? You may not need to. You may need to. You may not need to. So you want to really ask about the impact of your erections afterwards, because there can be a lot of erectile struggles afterwards. There can be struggle to orgasm, struggle to ejaculate, some urinary incontinence. We really want to make sure we're doing the best we can in the midst of this. Now, when our body doesn't work the way we want it to work, and whether our erections don't work, or maybe we had to have a double mastectomy and we're feeling strange and different in our body, or there's numbness, we're going to usually feel betrayed by our body. There's a betrayal of our body, or there's a grief process, or there's both, right? This is really normal. I want you to not bypass that experience. The grief process is key. You are allowed to grieve your old body and your old life. You may get angry, you may get sad, you may get confused, you may feel this existential funk, you may feel anxious, and you need to get help, right? It's so important to have support systems. Most hospitals have cancer support groups, and that's key, because then we don't feel like we're alone. So the support systems for our mental health around this are key. But after and during your grief process, I want to invite you into our new normal. So we're going to talk about what is it like to really embrace the opportunity for a new normal, because our bodies are unbelievably resilient. I have a mentor, and this little vignette is so key. My mentor, one of my older mentors from 15 years ago or something, Dr. Mitchell Tepper, he calls himself the prophet of pleasure. And he is so wonderful when it comes to the world of sex and disability, because what he has done after his spinal cord injury is well, he didn't do this, his body did this. He just followed the lead of his body and was a good student of his own body and realized he had so much pleasure in his neck and it got so aroused and he could have an orgasm through his ear. The body is resilient, right? If we don't feel any sensation anymore in our breasts, for instance, guess what? Those nerve endings and our pleasure capacity may be rewired up to our neck or our lips or our ears or our armpits or the back of our legs. You get to be surprised where pleasure inhabits your body, and it will. Pleasure inhabits our body. You have to be a student of your own body. You have to be willing to go on the journey and learn. So that's an important piece of this. Another really key important piece of this is taking care of your general health, your physical and your mental health, because your physical and mental health will absolutely impact your sexual health. So our physical and mental health may mean that we feel confident in our body again, that we feel alive. Sexual passion is passion. Passion is how we feel alive, right? We get this from our outer world. What do you like to do? What gives you joy in the world? Do you like to dance? Do you like to paint? Do you like to take a bath? Do you like to walk your dog? Do you like to go to the Humane Society or the dog shelters and walk their dogs? What do you like to do that brings you joy in the world? So you have to go on a journey to be willing to find this. So a few other solutions to think about. If you haven't caught our episode on sex and depression with Dr. Craig Heacock, a great psychiatrist, please catch that. It's another deeper episode we did last week. And what happens when we undergo cancer, whether we are the survivor or the partner, is that we can get depressed. And if we get depressed, there are two key pieces you can naturally do to really help yourself. So it counts for depression and it counts for cancer. And that is exercise. Preferably supervised exercise. So having a trainer if you can afford one, or going to a group class, even at your community rec center or on Zoom, right? Having accountability to help you move your body is key. And also, by the way, move your body in a way that you enjoy. If this is obligatory, I'm on the treadmill and I really don't like this, don't do the treadmill. If you like to do wild dancing in a dance class, do that. If you like to go walking or play tennis, do that. Do what your body loves to do. You have to go on that journey to find movement joy inside, from the inside out. And then have somebody help you. Have that be a supervised experience so that you do it. Because when we go through a cancer journey, our bodies feel really different. And they may be low level and low energy, especially if you've done chemo and or radiation. So finding movement in your body is the best thing you can do. It is the best thing you could do for your mental, physical, and sexual health, because you're going to feel confident and you're going to feel electrified. You're going to feel your function again. You may look different in the mirror. Your body may feel different, in terms of how it did before cancer. But you're going to have to find a new way to feel your body and become in relationship with it so that you are having your compassion for your new body, right? That's key. Can we generate the self-compassion? So that's exercise. Another key piece for offsetting depression, and of course it matters immensely when we're going through a cancer journey, is sleep. Sleep hygiene. Go to bed at the same time every day, wake up at the same time every day. Go to bed with the moon, wake up with the sun. Those are the key pieces around depression and having a good mood. And if you live in a place like Alaska where the sun sets really early in the winter, get a happy lamp, right? Because if we have seasonal affect disorder, sad, we want a happy lamp to keep us happy. Those are like lights that sort of simulate the sun. And even if you live in somewhere like Miami, where I'm from, and it's just not enough sunlight, or you just need a little more, get that happy lamp. The happy lamp helps us feel happy. And it's good, right? We're trying to just take every tool in the toolbox to help us feel alive and happy, because we're going through a hard journey. Cancer is a hard journey. Whether you are the caretaker or the survivor, cancer is a hard journey. So we want to do everything we can to help ourselves. So even if you have a bad night and you go to bed at 3 a.m., still wake up at the same time at 7. Because if you wake up at noon, you're going to feel really groggy, and that actually impacts your mental health more than getting less sleep but waking up at the same time. Okay, so other things to think about for your physical, mental, and sexual health are your exercise, your diet. Think about an anti-inflammation diet. I'm not a nutritionist. I'm not going to pretend to be. However, I do know that some people do plant-based and some people do more paleo and meat-based. Some people take out grains. Some people take out dairy. You could do what you want to do. Research this. Talk to a nutritionist. Be your own advocate. But if you do nothing else, take out sugar. Sugar zaps us. Sugar just makes us feel bad in our body. Then everything in moderation. You may have a little sugar, right? That's just okay. But on a general basis, you want to take out as much sugar as you can, the processed sugar, because that is really inflammatory. It makes us feel sluggish. It doesn't help us feel good in our body and our best selves. So that's what I want to say on the diet piece. The last thing I want to say is about mindfulness. Mindfulness helps us feel relaxed. Arousal, pleasure, orgasm live and come and be, it is birthed from relaxation. If we are stressed in our sympathetic nervous system, fight, flight, or freeze, right? Fight, flight, freeze. Arousal is not happening. Arousal happens when we are relaxed, when we are in our parasympathetic nervous system. So what do you do to inhabit your parasympathetic nervous system? Do you take a bath? Do you have a glass of wine? Do you have a cup of tea on a cozy rug or a couch? Do you go for a walk? Do you sit outside and breathe just air, the nature? What do? Do you read a book? Do you self-pleasure? Do you put oil or cream on your body? What do you do to enjoy yourself and relax? Because that is where arousal will emerge. And you can be mindful with this. You could be mindful how you chew your food. You could be mindful if you meditate. You could be mindful as you slowly walk and notice how your feet land on the ground. So many different ways to be mindful. So many different apps out there to help you. And just cultivate some practice of mindfulness, especially 10 minutes a day. How does my breath feel? How does it feel going through my nostril and back out? So those are really key pieces. Those are how we move our body, what we put in our body, and how we notice our body, right? That is exercise, food, and mindfulness. That's going to help us inhabit our body differently, and we bring that to our sexuality and our sex life. We may feel insecure about our body image. It is a journey to feel secure and confident in our body again. It is for everyone anyway. But certainly after cancer, it's a journey. So if you want to wear a new top to cover your new top, if you've had breast surgery, find a cute top and you can learn to slowly take off that top. Or maybe you keep on the top and it's part of your sex life and that's okay and it's such a fun top. Maybe you buy new toys because you're trying to find different parts on your body that come alive. So what you do to really feel your body from the inside out and appreciate it and have compassion for the journey it went through and how you want to adorn your body is really key in terms of feeling comfortable and in relationship with your body. Okay, what I want to end with is how do we redefine sex? Because sometimes our erections don't work. And sometimes our vagina is just too dry or in too much pain. And by the way, if you have a lot of pain and the oil or the lube is not working, I should say, there are great pelvic floor physical therapists to help you. I'm going to say that again, pelvic floor physical therapists. They're excellent. It's a whole profession. It's a whole unknown profession. And it is key because it can help your whole body, whether it is your penis or your vagina, right? It doesn't really matter. They can help you relax and get those body parts and nerve endings kind of back rolling again, right? Or really back rolling again. Sometimes with certain surgeries, we're rendered numb and we have to, again, redirect our pleasure. So let's talk about redirecting our pleasure because this is an important piece. Most of us have sex in a performance-oriented way. In my field, in the sex therapy field, we talk about this as the performance-oriented model of sex. This model of sex is how we're taught to have sex, right? It is a stairwell of pressure. This is a terrible way to have sex, but I'm going to talk about it anyway because most of you will be like, yeah, that's me, right? We look at each other, whether we're at a bar or on Zoom or or across the kitchen counter for 25 years. I get lots of questions. What if we've been together 10 years or 20 years? This is for you, whether you're new or you're old to your relationship. It really doesn't matter. It starts with a look or some sort of invitation. Usually the invitation is not sexy enough, by the way. We want to work on those sexy invitations. And then we may kiss, and then the clothes come off. And then we have some sort of main dish. For a lot of us in heterosexual connections, it's intercourse. But some sort of main dish, no matter the configuration of people in the room. Followed by, really, this pressure to have this orgasm. Orgasm at the same time. Right, in Hollywood they do that. In Hollywood they ascend the stairwell in 90 seconds and then have their orgasm. That's a lot of pressure on the genitals. It says that they are on stage, they must perform well, they must have a strong erection, be well lubricated, and have this easy orgasm. This is A, boring to do it on the stairwell at the same time all the time, and B, a lot of pressure. And what happens is if we fall off the stairwell because our genitals don't work, then we go, ugh, I failed. And we feel bad about ourselves. And then we go up the stairwell again the next time going, I hope that doesn't happen again. I hope I don't lose my erection or not get an erection, or I hope I don't have pain with intercourse, right? And when we go like this, I hope that doesn't happen again. That is stress. That's in our sympathetic nervous system, in our fight, flight, or freeze, right? That's not relaxing. That's not going to help us have our arousal. So we want to relax into it, which means we got to get rid of this model because this model, like I said, is garbage. So garbage model goes in the garbage. And what I want you to think about, because our field loves to advocate for this, and it is correct. It is the pleasure-oriented model. I have taken this model and made it into my fun metaphor, which I call the cheesecake of pleasure. In this cheesecake of pleasure, I want you to imagine going to the grocery store. And if you don't go to the grocery store anymore because of COVID, remember when you did. And if you went to the dessert section, so like the frozen dessert section, you had those cheesecake platters with all these different slices of fun cheesecake, different flavors, Oreo, chocolate, almond, blueberry, fun flavors, right? Mutually exclusive flavors. Now, what we can do is add all the fun, sensual and sexual and erotic activities you both like to do. Or if you are single, what you like to do. You might like to take a bath and then touch yourself. You might like to touch yourself in different areas of the room or your condo. You might like to read a sexy book. You might like to watch something. You might like to do all these things with a partner if you have a partner. You might have a kissing date. So many couples need kissing dates because they're not in sync with each other. If you are not in sync with your partner, have a kissing date. I'll do a whole episode on kissing dates later. Some people like anal play, right? I can't tell you how many people where their genitals from a cancer journey, for instance, are rendered number or more difficult to access. And then they find, again, different parts in their body that bring them so much pleasure. You might like taking a sexy shower. You might like a sensual massage. You might like intercourse. That is totally fine. The idea is that you add flavors that you both enjoy and both derive pleasure from. This is a pleasure-oriented model because pleasure is the name of the game. Maybe we're having a sensual massage and my pleasure as a receiver is 10 and my partner's pleasure, because they're giving me pleasure, is 5. But we're both having pleasure, so we're in the name of the game. So you don't have to have the same amount of pleasure. You just have to make sure you're both having pleasure. And if you're both like, this is kind of sad, we're not really having that much pleasure, get rid of that piece of cheesecake and go back to the fridge and have a different piece. The whole point is that you have lots of pieces to choose from, so you can pick and choose as you wish. And you might eat the entire cheesecake one night, and that's excellent. Or you might eat one piece, and that's excellent. And you might eat the piece of cheesecake in the same order as that stairwell that I just threw in the garbage, but it's about the journey. and just not about the destination. Now, it doesn't mean you can't have orgasm. Have orgasm if that emerges, great, but it's a byproduct of your pleasure. The goal is pleasure because it's not pressure filled. So what I'm doing with this model, this cheesecake model, pleasure-oriented cheesecake model, is I am redefining sex. Sex is not just this heterosexual or heterocentric activity of intercourse, penis, vagina intercourse. It can be, but it doesn't have to be. It could be oral sex. It could be manual stimulation. It could be self-love. It could be a sexy shower. It could be lots of different things where we go on a journey to explore and be students of our body, to find pleasure in our body. Again, you want to be a student of your body. You want to have compassion for the parts that may not work as well. And then you want to say it's an opportunity to find the new areas that do electrify myself or get electrified. All right. That is the end of our journey here together on sex and cancer. We will answer any questions you have. I don't see a lot of questions here. I see a lot of hellos and nice comments. Thank you. And here on our Adam and Eve team, all of us are knowledgeable. So if you want to shoot into the inbox at Adam and Eve, any question you might have, whether it's sex and cancer or something else, please make it an appropriate question. But all things related to sexual health and education, we're happy to answer the questions and give you the knowledge you need. All right, thanks for watching, and we will repost this later on, but keep it up if you want to watch it live for the next 24 hours. Take care.